Henry Ford Jackson Hospital and IEP Emergency Services Physician, Dr. Alan Lazzara. Alan, welcome back to the show.
Hey guys, thanks. Thanks
Nice
for having
to see
me.
you.
Happy Thanksgiving.
Happy Thanksgiving.
Yeah.
If someone chokes on a yam tomorrow, they'll see you in the ER, right?
I hope not. I hope
You have
not.
to work. You're working Thanksgiving.
Yeah, I was saying before, somebody has to be there, so we alternate holidays. But there's a lot of people that work on Thanksgiving. People that work at Meijer work on Thanksgiving, and in case you need to run out and forget your buttermilk or whatever you forget. And police officers, ambulance, staff, paramedics, everybody.
Yeah, thanks
So,
to everyone working.
Yes.
So, are you anticipating Thanksgiving-related emergencies in the department tomorrow?
Nothing unusual, but we usually know that when somebody comes in on a holiday, it's an emergency.
Right.
Most of the time, we're there for when we're there to provide reassurance a lot of days of the week, and that's okay, but we're also there for when the real bad emergencies happen. So, and they happen just like any other day.
Turkey fryers.
Oh yeah.
That's actually, that's
That's
a
a
big deal. Yeah, those videos are horrible.
Has anyone come into the ER because they've just eaten too much?
I have seen that, yes. I have seen that. Usually the day after, or you see a lot of people come in like the days before the holiday because they're not feeling well and they want to be better for the holiday.
Yeah.
So yeah, we're happy to care for anybody at any
Can you
hour.
imagine that? Why'd you go to the ER? Well, I had too much food on Thanksgiving.
It can be very uncomfortable.
Oh man. Well, this is cold and flu season,
Yes.
and we've got some things, seasonal risks that you wanted to alert
Sure.
our viewers about.
Yeah, I talked with your wife Karen, and I thought it was a good idea if we put together like a kind of a monthly educational shows that we could cover certain topics, because I think everybody who comes to see their doctor has curiosities and wants to know what's what. And so this month we're going to cover respiratory illnesses, because it's something that you're commonly going to find in the fall, the winter, when we all go inside together and breathe the same air. So this is a very short PowerPoint that I put together, but you guys can ask me whatever you like. So to start, the lungs are predominantly where these respiratory illnesses happen. They happen in the upper airways too, like the nose and the throat. But the normal lung anatomy, the lungs are kind of like a little city of little bags put together called alveoli. And the alveoli are those little bags on the right, and around them are the white parts, the airways that get really super tiny, and the blood vessels that help do the gas exchange between the carbon dioxide and oxygen in your bloodstream. So they're pretty darn important pieces of our body.
What happens inside that respiratory system when we're sick?
So when you're sick, there is a variety of things. Those tubes can get clogged, the inside lining of the tube can get inflamed, and the cells can come off. Mucus gets produced at a normal rate most of the time, but if you're sick, that mucus can increase with inflammation in local white blood cells that try and protect your airway. And so when you get a bronchitis, it's traditionally mostly just mucus and upper airway stuff, but a pneumonia is when you start getting fluid in those little bags called the alveoli. The fluid in those bags make it difficult for air to exchange and carbon dioxide and oxygen to be transferred back and forth, that very thin single cell membrane. So that's why people have difficulty breathing, they're coughing up mucus. A lot of people come and they say, well, I've been producing yellow or green mucus, and that doesn't necessarily mean you have a bad pneumonia. It just means that your white blood cells are fired up and making more of that mucus. So,
Why is pneumonia so dangerous for folks with pre-existing conditions or the elderly? It seems like once you hear pneumonia, you do get a little worried.
yeah, I mean, I think traditionally that was one of the ways that people would die when we didn't have antibiotics. I mean, antibiotics were only invented shortly after or during World War II. So for a long time, we didn't have mechanisms to fight those pneumonias. So that they used to call it an older man's best friend. That was the thing that allowed him to die naturally. And so now we have lots of support that we can give our patients with antibiotics and breathing treatments and ventilators and things like that. But it's it's an interface with the environment. So anytime you have an interface with the environment, you're going to be exposed consistently to bacteria, viruses, and other pathogens. And so it's a first line of defense.
COVID is also a respiratory virus.
Sure, yeah, we've talked a lot about that and kind of enough about that as far as I'm concerned. But yeah, so it's a different kind of pneumonia, and it's a viral pneumonia. And so the chest x-ray that you see there looks different than a bacterial pneumonia does. It's kind of a multifocal pneumonia, meaning it's in all the different lobes, all the different parts of the lung, usually on the outside of the lung. And there's those white patchy spots you see all over. That's fluid in those alveoli.
That's what your lungs must have looked like when you had COVID, because you were.
Yeah, I felt awful.
We see a lot of people who have normal chest X-rays that have COVID, and typically this person had actually been intubated. This was a photo offline off Radiopedia I got, but you can tell there's a tube in the upper trachea. And it just becomes very difficult to make that oxygen exchange. And we were shocked. We'd see people who walk in with, typically your oxygen percentage between 95 and 100. Somebody would walk in, their oxygen percentage would be like in the 40s, which is unheard of. And they were still talking to you, which we had a real mind shift because this person should be on death's door, but they weren't. And it was very bizarre. But anyway, oftentimes when somebody comes to the emergency department and they have a respiratory illness, the thing that I'd like to go over with each of these is like what the typical course of when somebody comes in. So they'll get triage based off their vital signs. A nurse will see them, take down their primary complaint. And I really encourage people, if you're worried about X, say I'm worried about X, because then we can address that. I always ask patients, what's the most worrisome thing that you have going on right now? I'm worried I have pneumonia because my dad died of pneumonia. I'm worried I have, chest pain because my dad died of a heart attack. And so we can allay those concerns right off the bat.
Why are we afraid to speak up sometimes?
That's a very interesting question. I think, the emergency department and the hospital environment, I think, can be an intimidating place in general, because I think that we don't really get an education. We all take health class in high school, but I don't think we get an education on how to advocate for ourselves and to express ourselves. And even I feel that way when I go to the doctor. It's hard to get enough. There's time pressures. They're busy, and then there's a lot of like emotional overlay. Like people don't like going to hospitals because that's where my grandmother or my mom died, or I've had negative experiences because something bad happened there where I was diagnosed with X, Y, and Z. But we are very aware of that, and although it can sometimes seem like everybody's rushing around, we're looking to make sure there's nothing life or limb threatening. We're looking to make sure that we can, meet those needs and serve the community.
I think some people's expectations are a little high when they go to the ER. They think they're checking to a hotel, and that they need to be waited on right away, that someone's going to come up and get their stuff, take them back, and
Talking about you?
Well, yeah.
I wish that we had staff there to see every single person when they walked right in the door. And we do in one sense, because you get to see the triage nurse, but there's a backup that can occur during the day where, people get off work, and then times in the afternoon tend to be busier. But with that triage process, we're triaging, somebody who's had a stroke before somebody who has a cold. Both are very important. Both are things that need to be addressed. But we have to take the sickest person first. And it's our job too, because sometimes people who come in with colds have really horrible illnesses as well. So we have to find that needle in the haystack every time, and that's not an easy task.
Well, let's avoid getting sick in the first place.
Good idea.
Yeah. So one of the ways that you can avoid getting sick, so RSV is a virus that is often talked about in the news around this time, because a lot of kids get it and parents are scared of it. And in general, children are extraordinarily resilient, and so are our bodies if we take care of them. So 99% of kids that I see who have RSV do great. There's some kids who unfortunately had bad lungs when they were born, or they were premature, that are more at risk. So the really young and the really old, unfortunately, are more susceptible to these viral syndromes. But one thing that we can do is be cognizant that, just like we talked about with COVID, this is just basic wipe your nose properly kind of etiquette that we all should do. You don't need a a message from the CDC to tell us how to wash our hands. We all know to do that, right? We just have to remind each other.
And stay home when you're sick.
Yeah, that's always a good idea.
Yeah,
as well.
don't go cough on the apples at Meyer, please.
No, asthma, which is an important one at our house.
Yeah, so asthma is a different kind of breathing difficulty, but related in some ways to COPD or emphysema from smoking. And these are patients who are more at risk for those viral syndromes, more at risk for pneumonias. What happens with asthma is that there's a robust immune response in those tubes, kind of like an underground root system of hollow roots for a tree. Those roots get swollen, those breathing tubes get swollen, more mucus is produced, and it makes it difficult to breathe air out. So they can often breathe air in, but they wheeze when they breathe out.
Right.
And so if there's more mucus and there's more debris in those lungs, and the airways are really narrow, it makes it very difficult to, again, exchange air, and people feel, it's one of my favorite things to treat is asthma or COPD, because we can make people better really quickly, and it's I gotta imagine a terrifying thing to not be able to breathe well. But we have a lot of great tools, and some of the treatments that we use, obviously, they vary by the type of pathology that somebody presents with. But for asthma and COPD and emphysema, we use breathing treatments to help dilate those tubes. For things like RSV and croup, there's not really great, specifically RSV, there's not really great treatments. The best thing that we can do is like humidified air, some breathing treatments, and just support the body through the illness. For croup, we give steroids to help narrow some of that swelling in the upper airway. And we give steroids to asthmatics and patients who have COPD as well. And then ultimately, I don't need a chest x-ray to diagnose a pneumonia most times. If you see somebody who's like, I smoked a long time, I've had a fever, I'm bringing up a bunch of mucus, like that person needs antibiotics generally. And chest x-rays also can lag weeks at a time before or after an illness or a pneumonia. So we put it all together with the clinical context, and some people who have what looks like a clear chest x-ray still end up getting antibiotics because we have this gestalt and experience that we've built up. And you weigh the risks and benefits. But most kids who have colds don't need antibiotics, I'll tell you that right now, because colds are caused by viruses and antibiotics are used to treat bacterial infections. Sometimes there can be an overlay where somebody gets a bacterial pneumonia, but most times kids don't need antibiotics and they just need kind of an expectant path where you watch them and wait. And then, we see parents a lot of times come in and say, my kid's been coughing for 2 weeks. That's really normal, actually. They did a study and it showed the actual length of an average cough after a bad viral syndrome is about 17 to 20 days.
Wow.
So yeah, that stinks for parents and the kids alike. So my favorite treatment in medicine for a cough is a teaspoon of honey about every 4 hours, because it works as well as like Robitussin. So
what's the best thermometer to get? If you're like me, anytime your kid gets sick, you go buy a new thermometer. 9 times out of 10, they don't work.
Well, so the most reliable temperature taking devices are the ones that are taking a core temperature. So either intraorally, rectally, but you don't have to do that. But the ear ones and the forehead ones that we were all, the random number generators we were all subjected to for a while, those are not very accurate. Yes, I had a temperature of like 93 at one point when I walked into work because it was freezing outside. But, and oftentimes we'll see, if you bring your child into the ER and say, I didn't have a thermometer and my child's been burning up, it doesn't matter. Parents who are with their kids a lot know when their kids have a temp, and we can see their heart rate's high. So we believe we believe our parents when they come in, because, and oftentimes I'll just say, this is what we've done. This is what I think it is. What are your other concerns? And then you can tell the parents are like, I don't you're uncomfortable. Let's talk about it. What are you worried about? What else can we do? I don't think you need a chest x-ray, but if you want it, no problem. Our job is to make people feel like they're being taken care of and to truly take care of people. But in some ways, it's a emotional and mental hurdle that we have to get over, and we need to communicate that because we want our patients to, feel comfortable going home.
Great.
I don't want to put anybody in the hospital who doesn't need to be there.
Fair enough to me.
Just a spoonful of sugar.
Yeah.
And honey.
And honey. Yeah, and honey.
Dr. Mary Poppins. Thanks, Alan.
Thanks.
Thank
My
you.
pleasure. Thank you.
Dr. Alan Lazzara from Henry Ford Jackson Hospital and IEP. More of the morning show right after this.